Anas Rahim, pain management specialist, makes a practice of bridging worlds of faith, family, and medicine. When dawn breaks over Miami's medical district, Anas Rahim, pain treatment doctor, begins another day of bridging the worlds of clinical practice, medical education, and community service. His role as a physician extends beyond traditional boundaries, shaped by a unique combination of cultural heritage, personal experience, and professional expertise that defines his approach to modern medicine. Roots of inspiration. The story of how Anas Rahim, pain management specialist, emerged as a leader in his field begins with his parents' journey from Syria to the United States in the 1980s. His father, fleeing political persecution, carried with him not only dreams of practicing medicine in America, but also a set of values that would profoundly influence his children's futures. These principles, fiscal responsibility, gratitude, and the importance of service to others, became foundational elements of Rahim's character and later, his medical practice. Growing up in Panama City, Florida, Rahim developed an early appreciation for both the natural world and community service. The coastal environment fostered a love for outdoor activities, particularly scuba diving, which he pursued extensively in the local waters. This connection to nature would later influence his approach to work-life balance and stress management in his medical career. Early leadership and community service. His dual enrollment at Gulf Coast State College during high school led to leadership roles in student government, where he initiated various community service projects, including Adopt a Highway programs and Habitat for Humanity projects. As community service chairman, he demonstrated an early ability to coordinate multiple initiatives while maintaining academic excellence, skills that would prove valuable in his medical career. During his undergraduate years at the University of Florida, where he majored in food science and human nutrition, Rahim's dedication to service deepened. His leadership role as treasurer of Project Downtown, a Muslim-based service organization, led to its achievement of 501c3 status and expansion of services to the homeless community. Under his guidance, the organization doubled its meal service frequency and developed partnerships with local agencies to provide job placement assistance, demonstrating his ability to combine organizational skills with humanitarian goals. Pivotal medical mission in Syria. The defining moment in Rahim's medical career came during his first year at West Virginia University School of Medicine in 2014. Responding to the escalating Syrian civil war, he participated in a medical mission to his parents' homeland. The experience in a recently bombed hospital, treating casualties of nightly bombardments, provided stark insight into the critical role of emergency medicine and pain management in crisis situations. This experience, though challenging, cemented his decision to pursue anesthesiology as a specialty. Personal adversity and specialization. Personal health challenges during his residency at the University of Florida would further shape his professional path. The experience of losing function in his right arm due to herniated cervical discs brought him face-to-face with the patient experience. The successful intervention of a pain specialist in restoring his functionality not only saved his medical career, but also inspired his decision to pursue additional training in pain management. This personal journey through recovery gave him unique insights into the physical and emotional aspects of chronic pain management. Shaping residency through research and family. Throughout his medical training, Rahim distinguished himself through involvement in various academic and research initiatives. His participation in the department's Resident Education Committee allowed him to influence training programs while contributing to ongoing research projects. The birth of his first son during his final year of residency added another dimension to his understanding of work-life balance and the importance of time management in medical practice. Today, as a clinical attending for a pain management fellowship program, Rahim approaches patient care with a perspective enriched by his personal experiences. His treatment philosophy centers on treating each patient with the same care he would provide to family members. This approach extends beyond individual patient interactions to encompass the entire healthcare environment, where he actively works to foster a culture of respect among all team members, from administrative staff to fellow physicians. Faith in practice. The integration of faith and professional practice remains central to Rahim's daily life. During a religious pilgrimage to Mecca in 2023, he demonstrated this intersection when he and another physician performed CPR on a pilgrim who had suffered cardiac arrest. The successful resuscitation, performed in one of Islam's holiest sites, exemplified his readiness to serve others regardless of circumstances. This event reinforced his belief that medical service is a form of spiritual practice. Adapting through crisis. His experience during the COVID-19 pandemic further demonstrated his ability to adapt and serve in challenging circumstances. Working in the COVID ICU as a pain management fellow, he collaborated with physicians from various specialties to provide comprehensive care during the crisis. This experience reinforced his belief in the importance of multidisciplinary approaches to medical care and the value of flexibility in medical practice. Legacy of community service. Community service continues to play a vital role in Rahim's life. His work with Mercy Without Limits supports refugees in Syria and other countries, while his local volunteer activities at food pantries and soup kitchens keep him connected to immediate community needs. By involving his children in these activities, he passes on the values of service and community responsibility that shaped his own development, creating a legacy of compassion and civic engagement. Rahim's approach to maintaining work-life balance reflects his holistic view of success. Regular physical activity, family time, and outdoor adventures, including an ongoing project to visit all U.S. national parks, provide necessary counterbalance to the demands of medical practice. He and his wife have already explored 5 national parks, making these trips educational experiences for their children while strengthening family bonds. Redefining success in medicine. His definition of success has evolved beyond professional achievements to encompass family harmony, spiritual connection, and service to others. This transformation in perspective comes from years of experience balancing the demands of medical practice with personal growth and family responsibilities. As a father of 2 sons, with a third on the way, he strives to demonstrate through example how professional excellence can coexist with strong family values and community engagement. Vision for the future. Looking toward the future, Anas Rahim, pain management expert, continues to build on the foundation laid by his parents while adapting to the changing landscape of modern medicine. His journey from the son of Syrian immigrants to a respected physician and educator demonstrates the power of combining professional excellence with personal values. Through his work in pain management, community service, and medical education, he continues to bridge the worlds of traditional values and contemporary medical practice, creating a model for future generations of healthcare providers. His story exemplifies how cultural heritage, personal experience, and professional expertise can combine to create a medical practice that serves not only patients' physical needs, but also contributes to the broader well-being of the community.